patients who are good candidates for FaceTite treatment have probably moderate laxity in the face. Also, patients that I really love to see for FaceTite may have a very large segmental area where they are great candidates for tightening the skin, but also fat reduction. If someone has extreme laxity, it's likely beyond the point of what FaceTite can do. So really that patient that needs, a little fat remodeling, a little liposuction, a little skin tightening, just kind of perk up the lower face and submental area, that is the appropriate candidate for FaceTite. Most of our patients who come in requesting the FaceTite procedure are looking to tighten the lower face. Most commonly, I would say that we're looking at someone who may have a very large bulbous submentum and are looking to reduce the bulk in that area. Those would be the most common reasons that we're seeing patients. So if a patient is interested in FaceTite, but they're not a good candidate, obviously we would explain the risk versus benefit, but likely we have another procedure here at Plaza Aesthetics and Wellness that would hopefully meet their expectations that they would be a better candidate for. If they are looking for more of a facelift type procedure, we would definitely refer the patient to a plastic surgeon if that's appropriate. But we also do offer another multitude of options, semi-invasive and non-invasive, that do treat, laxity in the lower face, some mental fullness, and contouring of the lower face and jaw. With FaceTite, it routinely is a one and done type procedure. Occasionally, we may recommend a second treatment. Usually, the patient is quite swollen after. We do administer quite a bit of lidocaine in a tumescence fluid, so the patient kind of looks like a bulldog when they're done. And usually that fluid goes down in about 48 to 72 hours. It's significantly improved. But often, depending on their concern, they may see almost immediate results, even though there's a large amount of swelling. If they had a very large segmentum, they may see that the fat in the area has now been removed. Also, one of the sometimes downsides to procedures like the FaceTite is our patients, we send them in a head wrap home. They do need to wear a compression dressing on the area. We recommend it for 6 weeks, and the first 2 weeks we really recommend it 24 hours a day, minimum the first week 24 hours a day, and that can inhibit, based off of the patient's lifestyle, if they're an appropriate candidate. Unfortunately, the world we live in, everyone wants that immediate gratification. They want that one and done, but they don't want anything that has downtime. And when you have to wear a compression dressing after the FaceTite, that can be prohibitive for some patients.